Now this patient presented to us with pain in the epigastrium radiating to the back, and a patient is a known alcoholic, and we have a CT image in front of us. Let us see what are the CT findings. Now look at the CT image and you will see that pancreatic parenchyma appears bulky. There is stranding in the peripancreatic tissue. There are non-enhancing areas in the body of the pancreas and in the relation to the spleen in the area of the tail, and we can see there is thickening of the anterior pararenal fascia. Perinephric fat is spared and adrenal appear normal. Let us look at the next image now. We can see again diffuse bulkiness of the pancreas. Most of the parenchyma appears to enhance, although there are a few areas of reduced enhancement. There is increased peripancreatic stranding, and again perinephric fat halo is spared, and there is thickening of the anterior pararenal fascia. Again, look at it. There is stranding in the mesentery, increased fat stranding in the mesentery, sparing of the pararenal fat. These are all, and there is thickening of the lateroconal fascia and anterior pararenal fascia, and there is some stranding around the uncinate process as well. These are typical features of acute pancreatitis. Now, classically in pancreatitis, the role of CT is to prognosticate, and we use an index called as CT Severity Index, which is a combination of two things: pancreatic inflammation, and you give scores based on pancreatic inflammation. If the pancreas is normal, is it enlarged, do you have peripancreatic inflammation, and do you have fluid collections, and based on that we give them points. And we also grade the parenchyma according to the percentage of necrosis, and we give points according to that. However, this does not take into account, this is the classical CT severity index, this does not take into account the extra pancreatic manifestations. So now what is recommended is a modified CT severity index, which takes into account pancreatic inflammation, and it converts pancreatic necrosis 30% or less or 30% or more. We don't take 50% as a separate numerical here. And we have added a score for extra pancreatic complications, which include pleural effusion, ascites, vascular complications, parenchymal complications, GI involvement. And based on that score, now you grade the pancreatitis into mild, moderate and severe, with 8 to 10 being the severe grading. So it is very important to understand that this is what is followed nowadays, that is modified CT severity index. Thank you.